Good afternoon. York Region's Medical Officer of Health, Dr. Kareem Kurji, is here to provide an update on the COVID-19 situation within York Region.
The conference is now being recorded.
After Dr. Kurji's remarks, we will open it up for questions that are being moderated here. Dr. Kurji.
Good afternoon, everyone. It's with profound sadness that I am informing our residents that we have had our first death in York Region from COVID-19. This is a 72-year-old lady, a female resident of Markham, and we, on behalf of the Regional Corporation, wish to extend our deepest sympathy and lots of condolences to the family and loved ones of the deceased. She came back yesterday from Los Angeles via France and Tahiti and apparently collapsed at her son's home in Toronto. They followed a coroner's investigation, and following that, it was confirmed that she had COVID-19. Both the son and daughter-in-law are in self-isolation, and our investigation continues. However, I do wish to emphasize that there is no risk of exposure to any of the York Region residents, but our investigation continues. I also wish to provide an update to the Mark Heaven facility, which is a long-term care facility that we mentioned yesterday. So you may recollect that yesterday we had announced that this was a respiratory outbreak, but we were consulting with Public Health Ontario. In our consultations with Public Health Ontario, following the best practices that they follow, it was decided that this facility would be labeled as a COVID-19 outbreak. So we are treating it as a COVID-19 outbreak now. Having said that, the test results for most of the residents are still pending. One of the test results that came back shows that it was seasonal coronavirus, which is really the virus that causes cold. So we may very well walk back the COVID-19 designation if we find several negative tests. However, it is better really for us to take extra precautions in this instance. And I wish to praise the Public Health Ontario for the enhanced screening, which really adds on the testing for COVID-19 to the specimens that are submitted from long-term care institutions. So our investigation here is ongoing, but I want to re-emphasize that the past record of this facility is excellent, and they have managed many outbreaks before, and we are confident that that will continue to happen. We have been interviewing all staff, and we have been providing educational sessions to the staff. And yesterday I mentioned the fact that our public health inspectors were already into that facility when the respiratory outbreak was first declared, and they confirmed that everything that the home should have been doing was being done. We have also distributed some detailed guidance to them, and we are proactively distributing this guidance to other long-term care facilities in our region to ensure a state of readiness to respond should any of them necessarily come down with COVID-19. Next, I wish to report on the increase in the number of COVID-19 cases that we have seen in the last couple of days. Our numbers have now risen to 53. This is expected as folks return from vacations abroad, and many of them are coming back to Canada, which appears to be a safer place to be in. And again, I want to praise the province for its efforts at insisting on people staying at home for 14 days in self-isolation when they return from vacations. Most of these individuals that are returning are really individuals who have traveled abroad and are being now diagnosed with COVID-19. However, this brings me to another point. We know that many areas around us, Toronto, Simcoe, Halton, Peel, have already announced that they may have evidence of local transmission. The Chief MOH has already mentioned that there is local transmission going on in Ontario, and we have seen increasing evidence of this in York Region now. As those of you who have been following our website, york.ca/COVID-19, will see that a larger number of individuals now are being classified as under investigation. Previously, it was very easy for us to label them as travel-related, but now we are increasingly having difficulty in determining travel as the source of infection. So that lets me to really be fairly convinced that there is local transmission occurring in York Region. So what does local transmission mean? Local transmission generally means if we can't find any link to any travel-related case or any known case of COVID-19, we then believe that maybe the virus is circulating more freely in the community. And when that is happening, it is extremely important that the messages around social distance and measures around that are really followed by our residents. There are details on our website on what this really means, but essentially it means keeping a 2-meter distance from folks around you, avoiding crowds, working from home where possible, and this is particularly important for vulnerable individuals, individuals who may be elderly, individuals who may have immunocompromised conditions. Sometimes these comorbidities don't have to be major. It could even just be high blood pressure, because the experience in China seems to reveal that. So again, I would urge you to follow the measures that have been pushed by the province and others with respect to social distances. And I would like you to carry on protecting yourselves using the hand hygiene measures that we have been advocating. And again, a list of those are on our website. Remember how the virus is spread. It is usually spread through droplets when the infected individual, who is maybe infectious, sneezes or coughs, and these droplets then go onto the surroundings around one, and when you touch those surroundings and then you touch your mucous membranes of the eyes, nose, and mouth, that's how you get the virus into yourself. So please make sure that you take measures that break the chains of transmission. If we work as a community together, breaking those chains of transmissions, there is no reason why we couldn't defeat this virus. And again, our particular role in public health has always been containment. So we are trying to prevent new cases from arising by putting rings around the case and the contacts so that they don't have any chance of exposing the community and keeping the community safe. However, each one of us has a civic duty to society, and we are very confident that you will continue to comply with the instructions that we have given, the guidance we continue to give, and that has been our experience. Finally, I think there is hope out there. One of our first cases has now reached the point where both sets of swabs, 24 hours apart, have come back negative, and those are the criteria that the federal government and the province has put forward as being the criteria where we can discharge those individuals. So I'm pleased to say that our first case has now fully recovered. Also, there are several other individuals who are completely asymptomatic, and we hope in the days ahead they too will be considered recovered. So in essence, together we can get through these difficult times, and I have every confidence that we'll get through this difficult time. Thank you.
Thank you, Dr. Kurji. We will now open it up for questions.
Ladies and gentlemen, should you have a question, please press star 1. Your first question comes from Nick Westall with Global News. Please go ahead.
Good afternoon, Doctor. Toronto released news that also a Toronto man died in a hospital yesterday. We've heard from the province that they are considering additional measures for those who aren't engaging in social distancing. From your perspective, what more needs to be done at the provincial level to support what you and your staff are doing?
So in York region, our experience has been one where our residents have been very compliant with the messages that we have given. We have seen that they have really acted very, very responsibly. This is the sort of reactions that we have judged when we've followed up cases in close contacts. They have taken various measures to safeguard society from exposures, and I have every confidence that our residents will rise up to the occasion as they take their civic responsibilities quite seriously.
Is there a follow-up?
Yeah, and secondly, sorry, can you just outline, I missed the part where you're getting into the travel history of this 72-year-old woman?
Yes. Remember, this information could potentially change, but at the moment, the information we have is that she traveled from Los Angeles, but prior to that, she was in France and Tahiti. So we don't know where she would have acquired the infection from, but apparently she was received at the airport by her son and daughter-in-law, and upon arrival at her son's place, she seems to have collapsed after a period of acute illness. And we're just talking about hours then, and she passed then. And the coroner then got involved in this and expedited the COVID-19 testing, and that's why we are able to say that it was COVID-related death.
And sorry, just a quick clarification. And I know you may not be able to get into this, but any underlying health conditions a factor?
Unfortunately, we don't have that information at this point, but she was in her 70s, and we know from previous experiences that amongst the vulnerable populations are those who may be, in fact, over 60, so she is in that particular age group.
Thank you, Doctor.
Thank you.
Next question.
There are no further questions at this time. Please proceed.
Thank you.
Okay.
Thank you, Dr. Kurji.
Thank you very much indeed. Bye for now.
My apologies. Did you have another question? Are you willing to take that?
Sure.
Yes.
Okay. Your next question comes from Heidi Reiner with York Region.
Oh, hi. Can you hear me?
Yes.
Yes.
Okay. Could you tell me how someone who was presumably so sick that she died shortly after returning from international travel got through our border checks?
Those are very interesting questions. Thank you for those questions. You know, one would have assumed that her symptoms might have led to her being detected, either in terms of getting onto the plane or maybe as she got off here. From what I can judge, her symptoms seem to have included shortness of breath and a cough, but they may have included something further. According to many modeling studies that have been done, you know, when it comes to symptoms and signs and detection of those, sometimes individuals escape detection. I think the last modeling study that I saw from the London School of Hygiene seemed to suggest that about 42% of individuals who may be infectious tend to get through these screening measures.
Follow-up? Is there a follow-up?
Heidi, do you have a follow-up?
Oh, I'm sorry. Yes, and just as a follow-up, the woman in her 70s at Markhaven, is she continuing to do well, or has there been a change in her status?
She had to visit the hospital yesterday and had been returned back to the facility. Now, you know, when an individual goes to the hospital, it doesn't necessarily always mean that they needed to go to the hospital. We have been in some conversations with the hospital involved as well. And we are figuring out better ways of being able to deal with individuals who may perhaps need an assessment.
Okay, thank you.
There are no further questions at this time.
Thank you.